Hi, my name is Nancy Bartlett, and I am a family nurse practitioner student at United States University. Today is November 24th, 2025, and I am here to do a head, ear, eye, nose, and throat exam. So for transparency, I'm going to do a quick 360 in the room. I am a travel nurse, and I do work in the cath lab. So that's the cath lab behind us. We won't be going in that section. My Snell chart for the exam. The ceiling, as I make myself dizzy again. And the rest of my equipment that I have laid out to do this, and the floor. Whew. Okay, so like I said, we are here for the head, eyes, ear, nose, and throat exam, and this is being recorded and will be uploaded to YouTube for grading purposes. Do I have your verbal consent to do so?
Yes.
Great. And just for educational purposes, can I get your initials?
J.B.
And how would you prefer I refer to you as?
Jamie.
Great, Jamie. We're going to get started. I don't need you to move yet. I'm just going to do a visual inspection of the head. And the head appears normal cephalic, atraumatic, does have a little thinning hair anteriorly and posteriorly, but otherwise the hair appears, texture appears normal. I'm going to get a little Q-tip, and I'm going to take a peek at all your scalp, and scalp appears clear. I don't see any flaking. Any kind of anything other, no infestation, anything like that. So that's good news. Next, I'm gonna take a peek at your eyes, okay? And I'm just looking at them right now. Great. So first thing, I don't see any pitosis. I don't see any exophthalmos. I don't see any redness, any swelling. I don't see any drainage or discharge from the eyes. I'm just going to touch you, and I want to take a peek at the inside of your eyes. And the conjunctiva is nice and pink, and the sclera is clear and non-icteric. I am going to perform what's called a pupil light reflex test. And so I just want you to pick a spot beyond me, and I'm going to use my light, shine it in your eyes. And what I'm doing is I'm checking cranial nerves. So cranial nerve 2 and cranial nerve 3, which are optic and ocular motor. So that's what I'm going to do right now, just with my light. So up a little higher if you don't want. Perfect. And just stare at that spot and don't look away. Great. So what I was doing, I flashed the light in both eyes, and the second time I was looking more so for that intact, direct consequential response, which was there, and the pupils were both equal and round and reactive to light. So that's all great things. So next, I'm going to assess your extraocular movement. And so again, this is another test for cranial nerves. This is looking at cranial nerve 3, which again is that ocular motor, and cranial nerve 4, which is the trochlear, and cranial nerve 6, which is the abducens, if I'm pronouncing it correctly. And so what I'm going to have you do is just follow my finger, okay? And we're just going to do it a couple of times just because I need to see how your eyes react. So, ready? Perfect. So nice and smooth. They're coordinated, no nystagma noted, and no diplopia either. So that's good news. Okay. So the next one I need to look at is for accommodation and convergence, and that is again looking at the cranial nerve 3 ocular motor. And so what I need you to do is pick a spot in the distance, and then you're going to look at my finger and the distance and my finger as it comes in. And that's kind of like, so if you'll look at my finger here and follow it in, and in, and perfect. And so accommodation and convergence is intact. And so the next thing I want to do is test again cranial nerve 2, which is the optic nerve. I'm going to have you look straight ahead, and I'm going to put my hands out, and I want you to tell me when you see my fingers. Okay? Ready?
No.
Okay.
No.
Okay.
No. 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 No.
Perfect. So visual field is intact and looks really good. So the next thing we're going to do is we're going to use this little guy behind me. So I do have what's called an occluder, but I do need you to put your glasses on, okay? And I'm just going to turn this camera just a little bit so you can get us both in for this. And for educational purposes, we may not be quite 6 feet apart. That would be the appropriate field apart, but it wouldn't keep both of us in camera. We tried it multiple times. So this is where we're going to be. And if you would put that occluder on your, yep, and tell me which line you can read.
The bottom line.
Okay, and go ahead and read it.
LTFPH.
Okay, great. And if you'll cover the other eye with the occluder.
LTFPH.
Great. And now take the occluder down and read the line that you can read the best.
LTFPH.
Perfect. So this visual acuity is 20/20 with corrective lenses. I'll take that. All right. I'll set that down there. And so okay. I think I lost my train of thought for a moment. I'm so sorry. Let's see. Oh, we need to do the eye exam. Eye exam. So just pick a spot and don't move, maybe like kind of right, look out. I'm going to turn this on. Start out. And I'm just going to put my hand on your forehead. And look straight ahead. Keep looking straight ahead. I know I'm getting awful close, I'm sorry. All right. A little more, sorry. Great. And I'm going to do it again on the other side. So just my head on your head again. Great. So, red reflex is present. I was able to follow the retinal vessels to the optic disc. The optic disc is sharp. With clear edges. The cup to disc ratio is 3:1. I was able to see larger, darker veins, smaller, brighter arteries, and the macula appeared normal, and you had a normal foveal reflex. Okay, so, I'm gonna take this bad boy off of here though. Hope I'm not out of frame. Okay. So, the next thing I'm gonna do is I'm just gonna touch, well, look at your nose actually, and your nose looks in line. I don't see that it's out of alignment. I don't see any, deformity or anything like that. I'm just gonna touch your nose. Any tenderness?
No.
No. And how about up here?
No.
Great. So, no tenderness at the frontal or maxillary sinuses. I'm gonna get my same scope again with a different head. So the otoscope now, instead of the ophthalmic. Time to get close and personal again. I'm going to take a peek inside your nose, so this little guy is going to go inside your nose, okay? So turning on my scope. Great. Take the other side. Go around this way. This way. Okay. So, the nasal mucosa appears pink and moist, your septum appears midline, and your turbinates appear normal also. So the next thing I want to do is I have a couple of jars here, and this is the first one. And so what I'm going to do is just uncover it and have you smell and tell me what you smell.
Coffee.
Perfect. And this would be the second one. What do you smell?
Vanilla.
Perfect. So we just assessed your cranial nerve 1 olfactory. Okay. Now, we've got the ears, the eyes, ears. We need to move on to the ears. Okay, so I'm just taking a peek at the outside, and the ears again appear normal in size and shape. I don't see any lesions or any kind of deformities on the outside. I am just going to touch. Any tenderness?
No.
Okay, great. So this next test, I am going to whisper something, and I just want you to say it back. What it's doing is it's testing cranial nerve number 8, which is your vestibular cochlear. I don't pronounce things very well. Sorry. So I'm going to stand behind you, and I'm going to whisper something, and you're going to repeat what I said.
Don't be late.
Perfect. We're going to do it one more time.
Perfect patient.
Perfect. So, whisper test is good. Hearing's intact that way. So, the next thing that I want to do is I have my tuning fork here, and this isn't going to hurt you. What I'm going to do is I'm going to gently tap it against my hand. It's going to kind of make like a ringing noise. And I'm going to put it on your head and a couple of other places. And you're going to tell me when I put it on top of your head, where you hear it. Okay? Ready?
My ears.
Okay, so would it be in one ear, both ears, or are you kind of hearing it midline?
Midline.
Perfect. So, midline hearing, that's perfect. And so, I'm going to do it again. So it's kind of how it's gonna feel. So when I do it again, I want you to tell me when you no longer hear it, okay? All right.
Now.
Do you hear it? Okay. So when I take it off on this side, again, tell me when you don't hear it and when you hear it again, okay?
Here.
Beautiful. So Ryan's test also was good. So the next thing that I'm gonna do is I'm gonna peek in your ears, if that's okay with you.
Yep.
And so I do have a different tip that I'm trading out. And I am gonna look in both ears before I say what I'm seeing. So, perfect. I'm going to insert this and I'm going to pull up and back. So this side looks just like the other one. The ear canal is clear. The tympanic membrane appears pearly gray. I can see landmarks of the malleus and umba. The cone of light is at 5 and 7 o'clock. So 5 o'clock was on the right and 7 o'clock was on the left. And so otherwise everything appears normal in his ear. Okay, so we've gotten our eyes, our ears. Okay. I'm gonna use this light, I think. So for just educational purposes, I don't have a tongue depressor, but I did clean my ruler, so I am going to use a ruler as a tongue depressor, just for educational purposes. Unfortunately, I work in a hospital and no tongue depressors in our unit. It's the cath lab. Okay, so I'm going to have you open your mouth, and I'm just going to take a peek in your mouth. And I see teeth are intact. I see soft palate is nice and pink. Take it, and everything looks symmetrical. I am going to use this just to press down. I want to see those tonsils, and tonsils look +2. I'm going to have you open your mouth again and say ah. Beautiful. Uvula is in midline and moves rhythmically and centered. Which look really good. Testing the is also ocular nerve, optic nerve 9. The glossopharyngeal is what we tested. And also 10, the vagus, with the The next thing I want you to do is stick your tongue out at me. Yep, and can you move it up and down and back and forth, and just really long out like that. Perfect. And so that tests cranial nerve 12, which is the hypoglossal. And his tongue protrudes normally and has full movement, and no deviation noted. Okay, let's see. Oh, my pen light's on. Okay. I have to do something else that I'm trying to think. I'm so sorry. Oh, yes. Can you smile? Big smile. And can you raise your eyebrows up? And can you puff your cheeks out? So that is assessing the cranial nerve 7 facial, which obviously is normal. I have a second swab, and what I'm going to do is just touch you in different places, but I do want you to close your eyes for this. And I want you to, before you close your eyes, I want you to tell me if the sensation is any different when I'm touching you, okay? So go ahead and, any different?
Nope. 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 Nope.
Okay. And can you tell me if it's sharp or dull?
Dull. 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 Dull.
Good. All right, so that is assessing cranial nerve 5, the trigeminal nerve. The other thing I want you to do is, can you shrug your shoulders like this and down, and can you press your cheek hard, turn into, no, not side to side, that way, there you go, and again this way, beautiful. That assesses cranial nerve 11, the spinal accessory. And I think oh, lymph nodes. I need to do lymph nodes. So I am going to touch you, and I might have to like get in here a little bit if you don't mind, okay? So could you lean forward for me just a little bit, just to be comfortable? So I'm going to go through, and these are the periauricle lymph nodes. No, the preauricle lymph nodes, sorry. The postauricle lymph nodes. The occipital lymph nodes. The tonsillar lymph nodes. The submandibular lymph nodes, the submental lymph. These are, find the tragus, here it is. So to the front, these are the anterior cervical. And can you turn your head slightly? Perfect. These are the post-cervical. And again, the other way, on both sides, and then subclavicle. And so, no lymph, let me give me a minute, lymphadenopathy noted. Okay? So the next thing I want to do is take a peek at your thyroid, okay? And so, can you swallow for me? Great. And I'm just going to feel again and swallow, okay? And I'm going to come from behind, and I want you to swallow. Great. Thyroid, I don't feel any enlargement or any kind of nodules. Was that tender at all when I was touching? So no tenderness noted either. Okay, and the last thing that I'm going to do is I'm going to touch your trachea, and I'm just going to touch and see how it feels. Any tenderness? No? Feels midline without deviation, and no tenderness noted. I think we just successfully, I think I'm done. I think that's it. I think that concludes our video. Thank you for joining us, and much appreciated.